Hello everyone, greetings to you all. I'm Antonia. Here is Justice Rain channel. I'm here to give 7 ways to overcome depression without medication. To overcome depression, it helps to know the fact depression is a medical condition and not laziness or a temporary response to normal grief or disencouragement. Symptoms of depression. A major depressive episode is defined as experiencing 5 or more of the following symptoms every day or most days for 2 weeks or more. Depressed or irritable mood. Sleep problems, that is sleeping too much or too little, sleeping mainly during the day. Change in interest, that is not being interested in what you used to enjoy, or low motivation. Excessive guilt or unrealistically low self-image, significantly low energy or change in self-care, that is not showering anymore, significantly worse concentration, sharp decline in grades or performance, changes in appetite, that is eating too much or too little, agitation or severe anxiety, panics, attacks, suicidal thoughts, plans, or behaviors, including self-harm, that is intentionally cutting or burning yourself. It is important to remember that not everyone who is depressed is suicidal. You can still seek help even if you haven't demonstrated any specific suicidal or self-harm behaviors, or even if your symptoms aren't as severe or persistent as the symptoms noted above. Okay, I'm feeling depressed. So now what? Now that you know the symptoms of depression, some positive coping skills can be useful. All of the following techniques are supported by scientific research and medication prescribers like psychiatrists, and these skills are frequently recommended as important parts of treatment, even for patients who continue to take antidepressant medications. Warning: do not suddenly go off your prescribed antidepressant medications without first talking to your medical provider. Discuss any questions or concerns about the side effects of your medication with your provider. Practice these coping skills every day. I recommend doing many, if not all, of the following coping skills and techniques once a day when experiencing depression. It's important to know you probably won't be motivated to do any of them at first because depression frequently saps motivation. In other words, know that it's important to feel unmotivated until you are halfway done. The patients I work with who frequently practice these coping skills get better. The 7 techniques can be memorized with the acronym my peers. 1. Meaning. Find small ways to be of service to others. Find personal meaning by serving something larger than yourself. Remember, service doesn't have to be big to count. Consider this: success, like happiness, cannot be pursued, it must ensue. As the unintended side effect of one's personal dedication to a cause greater than oneself. 2. Your goals. Find workable goals that give you a sense of accomplishment. Most people feel guilty when talking about goals because they set unreasonable or unworkable goals. A goal is workable if it is 1. Something you can control, that is, it doesn't depend on others. 2. Manageable, that is, not overwhelming. 3. Realistic for you, not for someone else. 4. Measurable, that is, you know whether or not it is done or getting done. If something goes wrong with your goal, adopt a "what can I learn from this" attitude versus a judgmental "this is why I'm horrible" attitude. Also be careful when comparing your progress with others. We usually compare our biggest weakness with another person's biggest strength. This is unfair and usually not accurate anymore. 3. Pleasant events. Schedule pleasant activities or events. Don't wait for yourself to be in the mood. For example, give yourself permission for a 30 minutes vacation, or schedule a healthy hobby every day. Just remember to do these activities with the right attitude. Also, practice gratitude. Take time to notice what went well today, not just what went wrong. Consider keeping a gratitude journal. Know that being grateful for your blessings doesn't mean you have to discount your problems. 4. Engagement. Stay in the present. This practice is sometimes called mindfulness. As best you can, during activities, try not to be in your head with self-judgment. You may not be able to turn off this self-judgment, but you can notice it and bring yourself gently back to the present. Research shows that people with higher self-compassion also have higher self-worth and self-confidence. 5. Exercise and eat right too. Doing moderate exercise about 5 times a week, 30 minutes a pop, can dramatically help your mood. Moderate exercise is a level of activity where it is difficult to sing from your diaphragm. While doing it, also pay attention to how the type of food or drink you are eating influences your mood. You don't have to do fad diet, but anyone will be depressed if they frequently binge on carbs, junk food, and energy drinks. Remember the virtue of moderation. 6. Relationships. Focus on people who lift you up. Interact frequently with others that bring you up, not people that bring you down. While it's okay to have some alone time, find a balance and don't isolate yourself or the depressed will linger. 7. Sleep regularly. Try to keep a regular sleep schedule. Keep a balance with not too little and not too much sleep. Staying up late one night and then sleeping in excessive the next day is a surefire way to feed depression. Also, don't try to solve problem late at night when your brain is half asleep. As you practice these coping skills, know that you are on the path to overcoming depression. In contrast, depression tends to linger when patients make up a reason why they can't do these things. No matter what medication you are taking, doing several of these activities every day, especially when you don't feel like it, is vital to the treatment of depression. These positive coping skills may take time and practice, but if you don't take the time to be well, if we don't take the time to be well, the periods of unwellness may be forced upon us later. Thank you.